you're talking about estrogen and progesterones. There's so many people getting tested for these, and now there's so many new ways because you hear all these people saying, well, blood is inaccurate because in blood, estrogen and progesterone are bound to proteins like albumin and sex hormone-binding globulin. But in saliva, they're not, so saliva is more accurate. Now, I go back and forth. I keep bouncing back and forth, and then I know there's a lot of people out there that don't know what to do, and it's hard because, you see these people that are suffering, they go to their doctor, they do a blood lab, everything's fine, and then they go do a saliva lab with someone, and they see that, something's deficient, like progesterone, and they're estrogen dominant. Can you give us your philosophy or thoughts on which one you feel is a little more accurate, and why we see this difference?
One of the problems with lab tests is that each lab tends to have its own standard, and there are practically no studies in which healthy people have been sought out for blood tests to establish the normal. They usually use people who are sick with something else to establish the normal for a given blood test result. So it's really kind of irrational to pay much attention to what they call normal, unless you have someone really healthy that you want to consider as your model. But the idea of protein-bound hormones versus free hormones, if you try to dissolve estrogen or progesterone, especially in water, you can hardly dissolve progesterone in oil. It's very hard to dissolve. It does bind nicely to albumin and several other kinds of protein. But one of the assumptions is that what you're measuring in the saliva is free in some sense, but they simply are not significantly soluble in water. So what is it bound to when you're measuring it?